introduce the topic, I'm going to just sort of paint just the tips of the mountains, and some of the other speakers will tell you a little bit more detail. But as has already been mentioned, there are more than 500,000 babies in the United States each year that are born prematurely. And some babies are so small that they, in fact, can fit in the palm of your hand. This is not a fake picture. We have babies, we have many babies right now. We've had an outburst of babies this size in the last several weeks. In 2010, nearly 540,000 babies were born too early. And as Carl was mentioning, it leaves them open to a variety of diseases, problems, not only acutely in the newborn nursery, but for a lifetime for some of them. Just to give you a frame of thought here in terms of what we're really talking about, these are the fetal growth curves, and these begin down at 24 weeks gestation, so beginning that much earlier compared to a term baby. The normal term gestation is about 40 weeks, and anywhere from 38 weeks to 40 weeks. Nowadays in our society, women usually don't let the Constitution let them go past 40 weeks. They want to be delivered as soon as possible. But if you go down to the other end of the spectrum, all of these weeks that would normally be spent in utero, many babies are born down here. There's approximately 2 pounds, 3 ounces for every kilogram. So if you're only born weighing 400 grams, you weigh 15 ounces at birth. Okay? 1,000 grams, which is a much bigger baby and makes me feel more relaxed when I see it at birth. That's a 2 pound, 3 ounce baby. A term baby, just a little bit above the 50th percentile, will be 7 pounds, 5 ounces. Now, the incidence of prematurity in this country, up until just very recently, has been increasing. And so down here, in 1990, 10% of all live births were preterm, and that has gradually increased up to 12.5%, and it does not place us very well relative to our friends in the other industrialized countries. We have a very high prematurity rate compared to the rest of the industrialized world. Fortunately, as you might get the suspicion here, but if we follow this out to 2008, 9, and 10, it's actually leveled off and has gone down a little bit for reasons that we think we might understand. We'll come to in a minute, but I'm not sure we do. Why are babies born prematurely? If anybody in the room could come up with the answer to that right now, you'd be very famous. It would probably be Nobel Prize winning material, but it's unlikely that you're going to come up with the one answer. It is very, very multifactorial, and there is no doubt that some of it has to do with economics, and some of it has to do with poverty. A lot of it has to do with poor access to medical care, and a lot of it has to do with I can't get health care because I have no insurance, or I can't afford the copay, or I'm afraid to go sign up for insurance because I'm not a citizen of the United States and I'm not supposed to be here. There are cultural and behavioral things, and there is no doubt that a lower socioeconomic status, especially low education level, has an association with prematurity. And we don't know exactly why, but I'll come back to that in a minute. Smoking mostly makes moms have smaller than expected babies, but it is also a factor in terms of causing prematurity. Alcohol and drug abuse are involved. And there are some drugs, crack cocaine being the most well-known drug that causes preterm labor, and in fact is often used on the street as a way of ending a pregnancy or trying to end a pregnancy by using crack. There's a lot of interest now, and the things that have asterisks beside them are things which are receiving more and more attention, is stress. And this may in fact explain why, on the next level, African American women have a much higher incidence of prematurity. Some of that may be genetic, some of that may be economic, but there is a growing body of data that that suggests that it has to do with stress and the way that you are perceived in our culture and what your resources might be, and the subliminal racism. And there's a growing body of evidence to confirm that. There are lots of animal models that show that that's a very active method of causing preterm labor, is just to cause chronic stress to a pregnant primate, and they end up delivering prematurely. There's a lot of biologic factors. If you were born as a preemie, you are more likely to have a preemie when it comes time for you to reproduce. And there's a lot of interest 5 or 6 years ago that even things like your dental hygiene and whether you have gum disease, that may in fact predispose you to prematurity. The thought there being a source of chronic inflammation in the body, easily recognized, may cause the uterus to want to contract prematurely. Then there are a lot of things having to do with your reproductive history. If you've had a previous C-section, if you have, in this pregnancy, begun to abrupt. Abruption is where the placenta begins to separate from the wall of the uterus. If you had multiple gestations, we were really meant as humans to have one at a time, and as soon as we begin having more than one at a time, that increases our risk of prematurity. And if you have 3 at a time, that's even higher, and if you have 4 or 5 at a time, that's the neonatologist's nightmare. And one thing that has changed in our culture is the increasing use of assisted reproductive technology in vitro fertilization and implanting more than one fertilized egg at a time. So the incidence of multiple gestations has gone up fairly dramatically. Preeclampsia, again, that's Nobel Prize winning material. If you could tell us what causes preeclampsia, the bizarre disease that pregnant women get that causes them to have very severe high blood pressure, swelling, kidney disease. It can progress to liver disease. It can progress to seizures, and it can progress to death if not properly managed or identified. And we just don't have a good handle on what causes prematurity, but is a major cause of babies having to be delivered, not because of preterm labor, but because you're trying to save the mother's life. Uterine anomalies, women who have malformations of the uterus. We have a lady now who has a uterus that has 2 horns, so it's not one uterine cavity, it's 2 uterine cavities, and there's 1 baby in each side. And then just the fact that some people go into preterm labor for reasons we don't understand. Infection may play a role in that. And these are not infections that people actually know they're infected. They don't feel bad. And in fact, we don't even know in many cases what the bacteria are that are causing the infection, but it stimulates the uterus to contract. And then there's a group of women who have problems with their cervix. Back in the days of politically incorrect language, it was called cervical incompetence. Now we call it cervical insufficiency. That's a little bit gentler. But there's something wrong with the cervix, and there's something wrong with the conjunctive tissue in their cervix so that it does not hold the baby tight in there the way it should. This is just to show you the difference in the rates of prematurity from various various racial ethnic groups. And again, you can see this non-Hispanic black population, which is the focus of a lot of people's interest right now as to why that is. And trying to figure out, A, why it is, and B, what we can do to try and help it. So in terms of the consequences of prematurity, as has already been mentioned, it is the leading cause of infant mortality in our country. The Institute of Medicine estimates that it costs the United States approximately $26 billion a year. Okay? And that does not include, that's just the initial upfront costs. It does not include care beyond infancy. It does not include the special education services that many of these kids need. doesn't include the additional caregiver costs that many families have to face for these reasons. So there's sort of two pieces of this spectrum. And the one that you'll hear most about and see all the pictures about and the dramatic stories about are the babies that are born very, very early. Babies that are born 15 and 16 weeks early. And they have a very high mortality. And this is data from a large network of hospitals in the United States. And you can see that at 23 weeks, only about 30% survive. 24 weeks, just below 60% survive. And then it gets pretty good beyond that. So at 27, 28 weeks, so 12 weeks early, you can expect over 90% of those babies to survive. But survival isn't the whole story. In terms of long-term morbidities, what do these kids face if they do survive? And there are a whole variety of problems. Some of them more common than others. Some get better and gradually resolve. But many of them leave our nursery having to go home on oxygen. A few leave the nursery going home on respirators. But imagine having your baby who's going home, is not even really supposed to be delivered yet. They're just about term, but going home with oxygen tanks at home, many doctor's appointments. The thing that most families worry about are the neurodevelopmental problems. What has this done to the developing brain? And the one that you usually see most people worried about is cerebral palsy. But in fact, cerebral palsy, while it is much more common in this population, is not our most common poor outcome. And the most common one is cognitive impairment, or what most people would call mental retardation. Kids whose development is not normal, they end up having lower IQs as they reach school age. Back in the dark ages, when I was beginning this in the 1970s, blindness due to prematurity and oxygen therapy was not uncommon. We sort of have conquered this, but there are still about 1% of our very small babies who lose eyesight. And even the ones who are not blind, if you come to our annual preemie reunion every year at the end of May, and you walk into the auditorium or the cafeteria where it's held, it looks like an advertisement for children's eyewear, glasses. Because preemies, even if they have not had oxygen exposure damage to their eyes, tend to be very, very, very myopic. And so they wear glasses at a very young age. It's interesting to see a 6-month-old wearing glasses. And they're very thick. So they're very, very myopic. And about 1 to 2 to 3% of the babies also have profound hearing loss. And we don't know exactly what it is that causes that hearing loss. But blindness and or hearing loss are major handicaps, just as cerebral palsy is a major handicap. Then less of a handicap, but very concerning to families, are children who may have normal IQs, they don't have cerebral palsy, but as they get older and begin to approach school age, it becomes quite obvious that they have behavioral problems, they have ADHD, they have very specific learning disabilities. So former preemies tend to have language problems, problems with math. Other things they do very well. And behavior. We don't know why they have these bad behavioral problems, whether it has to do with their prematurity or it has to do with the fact that they have been raised differently because the family has seen them as survivors. They're very special, and maybe limits have not been set like they were in your family when you were growing up. And you may have seen over the past year, year and a half in the media, the day this came out, MSNBC collapsed. But there is some new data that maybe, in fact, this population of kids have a significantly increased risk of having autism. Also a major problem. Now we know that there are certain factors that are associated with disability, and obviously the lower your gestational age, the lower your birth weight, whether or not you've had hemorrhage into your brain have cysts in the substance of your brain, a disease called periventricular leukomalacia, whether you go home on oxygen, whether you go home on a respirator, whether you have bad eye disease. But in every single study that's ever been done, one of the very strongest predictors of long-term outcome, as strong as your birth weight, as strong as your gestational age, is who you go home to. What is the level of socioeconomic and educational level in the family you're going home to? How much do they talk with you, sing to you, play with you? And so in going home, we want to encourage those families to have access to a nourishing environment, an encouraging environment, and putting programs into the family situation that will help them do that. So all of this sounds pretty gruesome. It sounds pretty bleak. But I've been doing this for a long time, and we see an awful lot of kids who do very, very well. This is a study called Epicure, which is a huge study done in the British Isles, and they looked at thousands of kids. And what they found basically is it's kind of a glass half empty, glass half full. That of all of these kids that they followed who were born from 22 to 25 weeks, half of them were perfectly normal kids. 25% had severe disability, and then another 25% had varying degrees of mild to moderate disability, but things which would probably not interfere with their lifestyle. Then they followed them until they were 6 years, and you can see that, in fact, the number that they would then classify as severe is even smaller. The milder group is pretty big, but one of the categories, and probably the largest category in the mild group, is whether or not you wear glasses. So I would be mildly disabled according to that definition. So it's a number of other people. And as I was saying, there are other things that are not as bad, but this is a study that looked at kids as they got to school. And the darker bars were the extremely preterm infants, and the light gray bars are their classmates. And the dramatically increased numbers of kids who in the classroom need one-to-one support, who need small group activities, who need a psychologist, who need physical and occupational therapy in the schools, and so forth. So if you are not going to go into medicine, but you're going to become the superintendent of schools for a large city, you need to take into account how much that's going to cost. Okay? If you're the parent, you need to take into account how hard you're going to have to fight to get appropriate services for your child in the school system. So again, the problems don't stop when they leave my intensive care nursery. So what can we do to prevent prematurity? Well, it's hard to figure that out because we don't know what causes it. A number of things have been tried over the years that don't work very well. So we used to hear of a lot of people being put at bed rest. It probably doesn't work. But things which are relatively straightforward and simple to provide in the right circumstance is just good prenatal care and access to care. Probably most important of all of that is that when you go to get prenatal care, that somebody begins to instruct you about taking care of yourself when you're pregnant and learning to recognize things which are suspicious about your pregnancy so that you can get in and get someone to react sooner rather than later. There is a new drug out there called 17-alpha-hydroxyprogesterone, which in specific pregnancies, very high-risk pregnancies, has been shown to improve outcomes and prolong gestations. This is something that is new. You may have read in the media that the company that's producing this drug just had a lot of bad publicity because they finally got FDA approval to market it, and it's so expensive that nobody can afford it. But it's out there. Cerclage is an interesting procedure for those women who have cervical insufficiency. If the cervix begins to loosen up too soon, you take and put a great big stitch through it and tie it tight so the baby can't get out. And if the cervical insufficiency is recognized early enough in gestation. This can be very helpful. It's often especially helpful in pregnancies where the previous pregnancy was complicated by cervical insufficiency. The other thing that many countries in Europe especially have done is to tighten up the guidelines so that octomoms don't happen. So in Israel, it is illegal to insert more than 2 fertilized eggs into a uterus. The British, while it's not law, they have very, very rigid guidelines in their professional societies. In the United States, artificial reproductive technologies is big business, and there are guidelines, but they are not enforced. And then something which people have tried for years to figure out ways of getting uterus, which is angry and contracting, to stop contracting, a whole bunch of drugs called tocolytics. Tocolytic is just a uterus relaxer. And some of them are pretty comical. Back when I was an intern and resident, there used to be women IV alcohol. And so you go into the labor suite and there'd be a woman absolutely slathered. Okay. If you were lucky, she wasn't throwing up, but some of the stuff that would come out of her mouth was pretty funny. It was shown not to be very effective at all. Unfortunately, we don't have drugs which can stop labor for very long. We can usually get it to stop for a couple of days, sometimes for a week or two, but the overall information that we have in the literature is that tocolytics probably do not help very much in prolonging the pregnancy. We need something else. There's one that fits in the palm of your hand. In this country, the first, I'm going to talk about technology. In this country, the first premature nursery, well, this was it. And you notice that there's bars there, and that's because this was at the World Exhibition in Buffalo, New York. This was a sideshow. Okay? You paid money to go in and see the preemies in those little heated boxes. And that's where it began in this country. And actually, this was pretty much a model that was taken from the French, who did the same thing. They had these exhibitions of babies in boxes. I like the nurse's uniform. Okay. So in terms of treatment advances, a whole lot of things have happened that improve our outcomes. So careful control of bleeding to prevent the blindness. The amazing changes we've had in the use of respirators and the design of respirators. The space technology that has allowed us to have IV pumps that run at very, very small rates. Giving steroids to the mother while she's pregnant to rapidly mature the baby's lungs. So if the baby is going to deliver in the next few days or a week or so, the lungs are more mature than they would have been otherwise. Surfactant therapy, which is something that the March of Dimes was very involved in the delivery, in the development of, so that we can put into the baby's lungs that chemical which is missing that makes them have lung disease if it's not there. From a nursing point of view, developmentally appropriate care, learning how to handle babies, treat them more gently, let them actually have some time to sleep and relax. Dramatic improvements in nutrition, dramatic improvements in our ability to give anesthesia to small babies safely. Just the development of neonatology as a subspecialty. There really weren't people who did this back in the 50s and 60s. This is really a development that began in the 70s, and now there's thousands of us. Nursing expertise. And this is an area where the March of Dimes has been very active in developing modules for training nurses on how to take care of both pregnancies and babies postnatally. And also, much more recently, the March of Dimes' very active interest in family support, going into nurseries with specially trained folks who can work with the family and help them through this very difficult time period. I'd like to finish by really raising an issue which is much more common, and that is that the incidence of prematurity that I showed you in the beginning that went up didn't go up because of 24, 25, 26-week babies. It gestation, they weigh a whole lot more, but in fact, I'm not out of the woods. This group of babies has still an increased risk of death, infection, respiratory disease, and they also have a risk of developmental delays and cognitive impairments compared to if they had gone full term. And this is just to illustrate that. So 34 weeks, this is a percent of babies born at that gestation who either die or have severe neurologic problems afterwards. And you can see it's not like the 24 and 25 weekers where we're talking about 20 and 50%. It's approaching 2%, but the dramatic difference between that group and just going another week, and then getting the term down here where it's much lower risk. And this basically shows the same thing. The risk of cerebral palsy, 34 weeks goes down dramatically, but it's up there. So, the simplistic conclusion is that this is a problem. This is a big problem for our culture. This is a big problem for our society. It's an even bigger problem for the families that have to deal with it. We have a very poor understanding of the etiology of prematurity, and because of that, we have very limited means to prevent prematurity, and it has very long-term implications. And finally, those of you who are in the audience and have your whole lives and careers ahead of you, this is your thing to figure out. Questions, comments? Here's one of our friends.